In this exercise video, we are going to review Hip 90-90, a hip joint and musculature training exercise. I commonly prescribe this for hip, knee, low back complaints, but really it's just part of the important keystone of the body, the core of the body, to keep the body healthy. So let's review the anatomy of Hip 90-90. We are working the hip musculature, so glutes, hip rotating muscles, hip flexors, anything that's moving around the hip, and stabilizing pelvis, low back. So to get into Hip 90-90, we are going to bring our lead or front leg forward and bring our back leg behind us like this. The 90-90 refers to the angle at the knee. If you're uncomfortable in a 90-degree, let's say of the back trail leg, you can soften that up a bit if you're too uncomfortable, but we will get into training ideas to help get comfortable and train that back trail leg in the next video. So for now, let's work on this front hip region. So there's 3 phases to Hip 90-90, as I often prescribe for my patients. The first is controlling yourself into your range of motion, stretching, isometric, strengthening that position, and then kinetic stretching. So in the first phase, once you're in this position, I often teach, take a deep breath in, trap that air in your belly so that you've got a strong core. And you still want to be able to breathe, and in my case I'm talking and breathing with an engaged core. And then what you want to do is sort of rock on your sit bones of your pelvis as you bring sort of your core or belly button area over that front thigh. Some people will even put a fist on their thigh and try and bring their core and their abdomen over that fist as your musculature helps control you over that front thigh until you've reached your maximum range of motion. And for me, for now, it's going to be right there. Then I'm going to put my hands down and let that position sink into a stretch. We want to do at least about 30 seconds to let that hip joint and musculature stretch out. But if you can go all the way north to 2 minutes, that would be ideal, and let that tissue really get comfortable in that position. Now, for video purposes, I'm not going to hold the whole 2 minutes. So let's pretend we have fast forwarded through 30, 60, 90, 120 seconds of me in this position. And now what I'm going to do is I'm going to do isometric contractions of my hip musculature and my core in alternating fashion. So we're going to start with isometrically contracting my front hip musculature. Your mind can focus on your foot and your front leg pushing into the ground. So I often tell people, start with a very light contraction, aiming for anywhere around 5–10% of what your maximum push would be, and just start by engaging that leg and foot, pushing down into the ground, and you should feel musculature all around your hip start to contract. If we're beginning with this exercise, we can start with just a count of 5. 1, 2, 3, 4, 5. Relax. And then alternate that with strong core as you rock a little bit further over your thigh into a deeper stretch and hold 1, 2, 3, 4, 5. Relax. Alternate back to the foot contraction, pushing through the ground using your hip musculature. 1, 2, 3, 4, 5. Let go. Core, a little further over that thigh. You can see your mobility and range of motion at the hip is increasing as you go through this exercise. 1, 2, 3, 4, 5. Let go. How many alternating repetitions you do of 5 seconds at 10% or 10 seconds at 20, 30, 40% as you progress better and better with this exercise is up to you and staying progressive with your training. After you've done that, You can add another phase called kinetic stretching, with or without your hands supporting you. You can then, with your core, move deeper into the stretch and push yourself out. Pull yourself deeper into the stretch and push yourself out. So that would be the phases of working the front hip in hip 90-90. In the next video, we're going to talk about how we work the back hip. And then in the third video series for hip 90-90, we are going to talk about how we transition from this position all the way through to the rear position to work the other hips the other way.